Hello, and thank you for tuning in. My name is Woosh Raza, and I'm currently the head of HR and L&D here at Phoenix Futures. Have been for coming up to my fourth month, and what an interesting 4 months it has been. So I have agreed to act as a bit of an interviewer this week and speak to various different people from different parts of the organization, and talk to them about mental health, and kind of areas of mental health, because it is Mental Health Awareness Week this week. And it's obviously such an important time for us to talk about um, mental health issues, what's going on in different areas of the organisation. So hopefully this week you'll see a series of webinars where I'm sitting down virtually and having a cuppa virtually with different people from different parts of the business. And today I'm delighted to have Tom Wright, one of our head of operations, with us. Hi, Tom.
Hi, Woosh.
How are you?
Yeah, not too bad, thanks. Are you okay?
Good, good. Yes, I am indeed. We are doing a series of webinars around mental health issues. So Tom has kindly started us off this week by talking about what's happening in prisons and what's happening in regards to with loneliness and isolation. So Tom, just starting off the conversation, let's kick off. I guess, why are you so passionate about mental health, and I guess what's really important for you in terms of mental health and mental health awareness?
Okay, so something I'm really passionate about is mental health within prison. We know so many of our service users experience mental health, and as service providers, it's something that we're responsible for supporting those individuals with. Now, loneliness and isolation is such a key area. I think within prison, loneliness and isolation is a daily issue for our service users. They're cut off from their loved ones, cut off from the outside world, feelings of shame, feelings of guilt. And I think all of this has an impact on mental health. But I think this is really key at the moment with coronavirus and the lockdowns that are in place.
Absolutely.
So lockdown's something that happens within prison all the time. If there's an incident, for example, the prison will be locked down. And what that basically means is that they are confined within their cell for that period of time. So at the moment, with the current lockdowns, they're in their cell for 23 hours a day, and they get an hour outside of their cell where they get a chance to exercise and meet their basic needs. So although they are familiar with lockdowns in a way that maybe we're not in the community, the lockdown that are now in place is much worse than what they would experience previously, because it's gone on for such a prolonged period of time. And I think one of the key things here is the fact that social visits have been cancelled. So this means that they're not able to have that contact with their loved ones in the way that they have been previously. And with only an hour outside of their cell a day, access to phone calls is also very limited. So I think all of this combined has a real impact on mental health, and it's so important that we have an awareness of this and that we support our service users during this really difficult time.
That's great. I mean, it really captured kind of what the key challenges have been, and as you say, not just with COVID and what that's meant, but actually outside of COVID, and what there's just some of those symptoms being exacerbated. You talked a lot about those challenges, and it would be great, I guess, for people listening to hear about what Phoenix are doing in terms of supporting those in prison during this time, because I know we're doing a lot to really help the people in prison during this time.
Yeah, so we've had to be really responsive and adaptive to the restrictions and the changes that have been coming into place. And I think it's something we're really good at within prisons. Because of the lockdowns, it means we can't do the one-to-one support in the way that we would like to at a number of establishments. Some establishments it is still going on, but again, it's very restricted. So we've been looking at different ways that we can work around that. And some of the things that we've been doing are around self-assessment packs, self-assessment release planning packs. So that's one way that we can reach out. Again, it's not the way that we would ordinarily like to deliver, but it's responding to the challenges that we've got. We can provide some support at the cell doors. We can have those conversations. And then in some prisons, we're even able to utilise technology, such as at H&P Wayland, where we're having a digital system. And with that, we can email the clients. So it's about just being adaptive to all the different things that are going on, particularly as the regimes change, and just doing what we can in order to access it in the best possible way.
Yeah, absolutely. And it does sound like you say there's a really broad range of different things there.
Yeah, and it'll be a continual process. I mean, as things start to change, we will continue to evaluate what we're offering and things, and as the restrictions lift, then we'll start introducing things back in as we go along.
Yeah.
But it's just so important at the moment that we're reaching out, because we know loneliness and isolation is it's just such a big issue, and the contact that we have is just so important that we're able to reach out, and they know that we can be there to provide them with support.
Yeah, absolutely.
So, Woosh, have you got any advice for any of our staff that might be experiencing loneliness and isolation?
Yeah, I mean that's a really, really good question. I think there's definitely a huge amount of focus right now on the fact that we're working differently. We're working in a way that, you know, is new to a lot of us, and isolation and lockdown. And I know that there's been a real, I guess, a significant amount across this country and the world more globally, I guess, around
Hmm.
feelings of isolation and loneliness. And I think we have a real duty of care at Phoenix to help those who work for us, who may be experiencing loneliness and isolation during the lockdown. And I think we do. I think we do that really well, because at the heart of everything that we do at Phoenix, we have a real commitment to our staff. Demonstrated in, I think, just all the wonderful things I'm hearing about managers going the extra mile, checking in with people. I read a really stark statistic about loneliness, and the effects of loneliness is the same as smoking 15 cigarettes a day. I mean, that's pretty harrowing.
Okay. Hmm.
And it just really highlights just the psychosomatic impact, that of loneliness, because we always think of mental health as mental health affecting only the brain, but it has a real effect on our body and physiologically as well.
Hmm.
So I think a few key takeaways for me, for anyone listening who might be experiencing loneliness and isolation, is, um, firstly, it's okay to talk. And I would absolutely actively encourage managers who may not have heard from people in their team, about various, maybe different people in the team that you've not heard, to just pick up the phone and just check in on people to make sure they're okay. I think there's a real stigma between people with mental health still, and I think that in the workplace that's even more of an issue, because we normally traditionally think we can't show signs of weakness, and we can't say that we're lonely or that we're struggling, because that might be equated to inferiority in the workplace, or that we're not competent, and that's not true at all. Every single person in the world right now is going through something, unprecedented, and it's okay to not be okay.
Hmm.
Um, so I think those will be the messages: is have the conversations. We have the social hub, which I know Lindsay's been promoting on external social media. It's been going on internally. That's great. It's a calendar of social activities that are being held, by amazing Phoenix staff all over the country. So if you do want an opportunity to connect as part of a community, then there's some really great opportunities to look at what's happening on that social hub. And details of that will be added to this podcast. So please do check it out. And yeah, pick up the phone and speak to people, I think, would be kind of some of the key things that would, from my perspective. So yeah, I guess there's a real impact for staff. There's a real impact for people that we support, especially those people in prisons. And it's great that you've talked about some of the things that we're doing to actively engage with our prison community.
Hmm.
I guess what would be the key takeaways that you would want to mention right now for anyone that's working in a prison service?
I think the key thing is that we just continue to reach out to our service users, because the, we have such a great relationship with all of our clients, and they really need us at this really difficult time. So just whatever the restrictions are, it's about being adaptive to that, so that we can actually make that contact. And I think it's something all of our staff really excel at in prison. We're used to working in restrictive environments with outdated technology and all the other things, that go on within a prison. So I think staff are naturally really resourceful within a prison setting, and I think that's came out by a lot of the things that we've seen coming out in regards to some of the ideas I shared earlier, but also things around sort of like distraction packs that we're giving out, wellbeing support, mindfulness in cell exercises, relaxation techniques. So I guess it's just, let's continue to get these innovative ideas out, and just make sure we're doing what we can during this really difficult time to be there and provide that support.
Yeah, absolutely. I think your message is really, it's powerful in the perseverance, because we've done so much, and we should be really, like you say, people should be really proud of the impact that they've had during this time. So that's great. That's a really great takeaway. And on that note, I think we will end it there. Thank you so much, Tom. It's been a pleasure chatting with you.
Thank you, Woosh.
No, it's been great having you. Thanks for being my guinea pig, my first victim. Now, this has been a really good way to kick off our Mental Health Awareness Week. Please stay safe for those of you that are out there. Please look after yourselves. And yeah, hopefully you will see more of these podcasts as the week unfolds. Many thanks. Bye, everyone.
Thank you. Bye.